My name is Professor Tze Min Wah. I'm a professor of interventional radiology, and I work at Leeds Teaching Hospital Trust in Leeds, United Kingdom, and I affiliated with the Leeds Institute of Medical Research at University of Leeds. For the unmet needs in treatment of primary renal cancers, for us in the interventional oncology community is to get minimally invasive ablative treatment into the guidelines, because currently even the conventional thermal ablation technology hasn't quite made it to the level 1 guidelines yet, and there is a true unmet needs. For this particular innovative technology, known as Histotripsy, is the needleless therapy without radiation and it's non-thermal, and it is at a very early stage at the moment to be trialed in small renal tumor. I think the future is very promising, and for now, we have to iterate through some of the research journey in order to inform the decision makers to help it to one day hopefully get into guidelines. So HistoSonics Investigation System in essence use focused ultrasound pulses that can generate cavitations, or in other words, bubble cloud, a very precise focal point that destroy tissues under ultrasound guidance. And this is, as I alluded earlier on, it is a needleless cancer treatment, and it does not involve any radiation, and it's non-thermal, so technically it's safer than a conventional thermal ablation when this is used in the correct indication. So CAIN trial is named after Professor Charles CAIN, and he's the late Professor Charles CAIN. And this trial is a single-arm, single-centers feasibility trial. Objective of this trial is to gain data and information to help to support the pivotal trial that has taken place. And the trial design is to try to evaluate the safety and efficacy of using HistoSonics system to treat small renal cancer for the first time in the world. So it is a global first trial. We found that in this initial breaking news release for this CAIN trial, it can treat small renal tumor safely, and its early efficacy rate at 30 days is 90%, which is really high at this stage. The longer term result will be required to be released in the coming months. But for now, it is proven to be safe and efficacious in the treatment of small renal tumor. So for clinicians wishing to embark on translating this innovative technology in small renal tumors, our learning curve and also our reflections following the trials it's important to be mindful of patient positioning, and it's important to optimize the patient's respiratory movement, especially working closely with anesthetists to ensure that the targeted volume of tumor is remain within the volume throughout the respiratory cycles. So after the our feasibility trial that has informed the pivotal trial, depending on the pivotal trial outcomes, I think that there will be early adoptions for various countries. I think that we will need to have a longer term outcome data, because in small renal cancer and in renal cancers, the minimum long-term outcome data will be at least 5 years, if not 10 years, for it to actually gain tractions into getting into guidelines.